You can run a 10-kilometer race without stopping and feel strong the entire way. Your resting heart rate can be lower than almost everyone you know. Your routine blood work can return clean and reassuring. And yet, a lethal blockage can still be forming quietly inside your heart. This is not a contradiction, and it is not bad luck. It is biology, working exactly as it was built to work. The human body does not raise alarms when damage can still be compensated. It adapts under pressure. It reroutes blood flow. It preserves performance while hiding structural failure beneath the surface. That is why, for a staggering number of Americans, the first sign of heart disease is not discomfort or warning pain. It is collapse. It is sudden death. This film is not about weak hearts or unhealthy people. It is about hearts that look disciplined, resilient, and powerful. We will explore how these hearts fail without warning, how danger is masked for decades, and why modern medicine now allows us to see the threat before it becomes irreversible. The heart is not simply a pump pushing blood forward. It is one of the most metabolically demanding muscles in the human body, consuming oxygen at a relentless rate, second after second, without pause. Unlike skeletal muscle, it never rests, never recovers between efforts, contracting more than 100,000 times every single day. To survive this workload, the heart relies entirely on a hidden supply network, a system of vessels wrapped tightly around its surface like roots gripping the trunk of a massive tree. These are the coronary arteries. Two major highways dominate this system: the right coronary artery and the left coronary artery. The left divides almost immediately, giving rise to one vessel that matters more than nearly any other in human biology: the left anterior descending artery. In emergency rooms, it carries a blunt name: the widowmaker. This artery feeds the front wall of the left ventricle, the chamber that drives blood to every organ you depend on. When a small branch fails, the heart compensates. When this vessel fails, the entire pump collapses. And that leads to the question that still surprises people. Why does this happen in bodies that train, that look fit, that feel perfectly fine? A healthy artery is flexible, smooth, and quietly resilient. Its inner lining, the endothelium, creates a frictionless surface that allows blood to flow effortlessly with every heartbeat. But arteries are not inert plumbing. They are living tissue, constantly responding to the forces placed upon them. Over the course of decades, those forces begin to leave a mark. High blood pressure applies repeated microscopic strain with every pulse. Elevated blood sugar alters the chemical environment of the vessel wall, weakening its defenses. Smoking introduces oxidative injury that interferes with normal repair mechanisms. Even sustained high-volume blood flow, common in endurance athletes, increases shear stress along the delicate inner lining. None of this causes sudden injury or immediate pain. Instead, it produces tiny defects, barely detectable damage, microscopic scratches, and tears. The body responds predictably. It attempts to repair what has been stressed. Cholesterol particles are delivered as raw building material. Immune cells arrive to supervise the process. Over time, those cells become trapped, swollen with lipid, and transformed into foam cells. Layer by layer, the repair zone stiffens, calcium accumulates, scar tissue forms. This slow, silent process is called atherosclerosis. And for many people, it begins far earlier than they realize, often in early adulthood, long before the first symptom appears. Most people picture plaque buildup the way they imagine a clogged drain, a passage that slowly narrows until flow is finally choked off and symptoms announce the problem. That image feels intuitive. It is also one of the most dangerous misunderstandings in modern medicine. Human arteries are not rigid tubes. They are adaptive living structures. As plaque accumulates inward, the vessel wall often expands outward, a process known as positive remodeling. The illusion this creates is powerful. From the inside, the artery can appear wide and unobstructed. Blood flow remains normal, stress tests look reassuring, exercise capacity stays high. A person can carry an enormous plaque burden while feeling completely healthy and fully capable. This is why running speed and endurance do not predict heart attack risk. Fitness measures performance under demand. It does not measure the integrity of the vessel wall itself. For many people, the artery only signals distress after the most dangerous phase has already passed. Plaque is not a single uniform substance. Some deposits harden over time, becoming dense and relatively stable. Others remain soft, inflamed, and dangerously fragile. Unstable plaque behaves less like a rock and more like a blister beneath thin skin. It may barely narrow the artery. Blood can still pass freely, but the structure itself is under constant tension. A sudden spike in blood pressure, extreme physical exertion, a moment of intense emotional stress. Any one of these can tear the thin, fibrous cap that seals the plaque from the bloodstream. When that rupture occurs, the contents spill outward, exposing inflammatory material and cholesterol directly to circulating blood. The body reacts instantly. It interprets the rupture as a serious internal wound. Platelets rush to the site. Clotting cascades activate with precision and speed. Within minutes, a rapidly expanding clot can grow large enough to completely seal the artery. Blood flow stops without warning. This is a type 1 myocardial infarction. It is not the result of gradual narrowing. It is the consequence of sudden occlusion. Downstream, heart muscle is starved of oxygen and begins to die almost immediately. There is another form of heart attack that receives far less public attention, yet it is especially relevant in people who train their bodies hard and push their limits. This is known as a type 2 myocardial infarction. In this situation, the artery is not completely blocked. Blood is still flowing, but the balance between supply and demand quietly breaks down. During intense physical exertion, the heart's need for oxygen rises sharply, heart rate accelerates. The time available for the heart to fill between beats shortens. Coronary blood flow must increase dramatically to keep pace. If an artery is narrowed by even 50%, it may perform adequately at rest. Under extreme demand, it cannot. The result is ischemia, a state where oxygen delivery falls short of cellular need. Heart muscle cells begin to suffocate. Structural fibers break down. As cells are injured, proteins such as troponin leak into the bloodstream. This is biochemical proof of heart muscle damage, even without a fully blocked artery. Arrhythmias, like atrial fibrillation, amplify the problem by disrupting coordinated filling and contraction. Together, these forces create injury that arrives without warning, often in people who believed their hearts were strong. Classic chest pain tends to appear only after an artery has narrowed beyond a critical point, usually around 70%. Below that threshold, the heart compensates quietly. Blood flow is preserved. Performance feels normal. Once that line is crossed, symptoms begin to surface during exertion and fade with rest. Tightness in the chest, pressure, discomfort that signals what clinicians call stable angina. But this is where intuition fails. Most heart attacks do not occur at 70% blockage. They occur much earlier. Soft, inflamed plaques are far more likely to rupture than large, hardened ones. And those softer plaques often cause little narrowing at all. The most dangerous lesions are frequently the least obstructive and the easiest to miss. This is why symptom-based screening repeatedly fails. The body does not report growing risk, it reports collapse. The heart does possess a final line of defense, a quiet, adaptive system known as collateral circulation. Over years of repeated demand, small secondary vessels can gradually enlarge, forming natural bypasses around partially blocked arteries. This process is encouraged by sustained movement and long-term cardiovascular stress. It helps explain why an older heart sometimes survives an event that overwhelms a younger one. Time allowed detours to form, but collateral vessels have strict limits. They cannot protect against sudden plaque rupture. They do not prevent abrupt occlusion. They buy time, not immunity. And in cardiology, time is the most valuable currency. After roughly 20 minutes of severe ischemia, heart muscle injury becomes irreversible. After 90 minutes, living muscle is replaced by scar tissue. Scar tissue does not contract, it does not pump. Saving heart muscle depends on one thing above all else: restoring blood flow before time runs out. Traditional blood tests tell us what is moving through the bloodstream at a single moment in time. They reveal ingredients, not damage. They cannot show what has already embedded itself into the artery wall. Modern imaging changed that limitation. A coronary artery calcium scan can detect hardened plaque that has accumulated over years. A score of 0 is deeply reassuring. A high score signals long-term structural risk, even in people who feel perfectly healthy. CT coronary angiography goes further. It visualizes soft plaque, the unstable lesions that have not yet calcified and are most prone to rupture. This technology allows danger to be identified before symptoms ever appear. It shifts cardiology away from crisis response and toward true prevention. Controlling blood pressure reduces mechanical injury to vessel walls. Managing blood sugar limits chronic inflammation. Consistent movement supports vascular resilience. But none of that matters without awareness. You cannot manage what you cannot see. The so-called healthy heart attack is rarely the result of recklessness or neglect. More often, it is the consequence of ignorance reinforced by biology's silence. The human body adapts with remarkable elegance. It compensates, it reroutes, it preserves function for as long as it can. And then, without warning, adaptation fails. For the first time in history, modern medicine gives us the ability to look inside the living heart, to measure structural risk before collapse, and to intervene while heart muscle can still be saved. If this story feels personal, that reaction is natural. Heart disease touches nearly every family, often without announcing itself in advance. If this film helped you understand something you were never told, take a moment to acknowledge that knowledge. Share your experience. Share your family's story. If you value science that explains the human body clearly, without fear, without exaggeration, support the work by liking this video, subscribing to the channel, and joining the conversation below. Awareness does not guarantee safety, but ignorance guarantees vulnerability. And now you know,